Hello. Over the last 20 or 30 years that I've been interested in mental health, I've come to realize that being able to effectively regulate emotions is absolutely one of the most important things to successful living. Just before I turned the camera on for this presentation, I took a moment to take some breaths, to tap through a few acupuncture points on my face and my chest, to have a sip of water and ground myself, to visualize myself giving this presentation and imagining how I was going to do it in a positive, regulated way. And I've, over the years, come to realize that there are so many different ways that we can regulate our system. And in the next 40 minutes or so, I am going to take you on a little tour through some of those understandings and those ideas. And I'm going to put a particular emphasis along the way on the population that we are particularly looking at today, which is people with hypermobility syndromes, people who have connective tissue issues, Ehlers-Danlos syndrome, and hypermobility spectrum disorder. But I'm going to hopefully stop you from switching off now and saying that's not relevant to me, say that the vast majority of my talk is going to be relevant for everybody. I'm going to be talking about our physiology and how our system, our body and our mind, this connected system, body and brain and mind, works beautifully to maintain balance in the system. But at times, and for a variety of different reasons, that balance is disturbed or disrupted, and we experience that as emotional or emotion dysregulation. So I'm very pleased to be here. My name is Dr. James Kustow, and I am a consultant psychiatrist based in London. I'm going to spend some time initially just explaining what we're going to cover in a little bit more detail. But I thought it would be useful and helpful for me to explain to you how I came to this realization of the importance of emotional regulation. What were the key factors in my journey? Well, when I decided to become a psychiatrist, I trained in medicine, and only after being a regular doctor for 2 or 3 years did I decide that psychiatry was for me. And so I suppose at that point, I realized the importance of mental health and emotional regulation. But it was various stops along the way that really fine-tuned this understanding. And the first stop on that journey was my decision to specialize in a form of psychiatry called liaison psychiatry, and in the US it's referred to as consultation liaison psychiatrist. It's the psychiatrist who is dealing with the interface between physical and mental, between mind and body. So right from the beginning, early part of my career, I had a very intimate and deep understanding of this connection and how important the body is. The body is in expressing emotion and distress, how central it is when in virtually every form of mental disorder, but particularly those rooted in trauma, how it really expresses emotion, but also is the vehicle by which you can discharge emotion. That understanding didn't come at that stage, but I dived quite deeply into this interface. And it was followed up with a particular interest in working with trauma. And the reason why I became interested in trauma was through a variety of techniques that I'd studied. I studied as a psychotherapist, integrative psychotherapist, as well as a psychiatrist, with an emphasis on body-based interventions for trauma. And one intervention which really had quite a powerful effect on me quite early on in my career was a technique which you may or may not have come across, but it involves acupoint tapping repeatedly on certain points on the face and the trunk of the body, while saying various statements and affirmations. And for a variety of reasons, and many of them understandable from a scientific perspective, and the studies are being done and have been done, and there's mounting evidence to indicate quite a potent effect from this approach, which is called emotional freedom techniques. And I was struck by how this particular technique was able to discharge emotion and physiological reactions that had sort of bundled together with memory that hadn't been properly processed, bundled together with a phobic fear about a particular thing, and how these techniques, which there are a number of them, which involve repetitive stimulation of some form of the body whilst tuning into the issue, were able to discharge trauma, to separate away that emotion and physiology, dissolve it, and allow a memory which is no longer charged to be filed away. And I started to realize just how much mental and physical disorder layered upon unresolved and unprocessed trauma. And when you don't process a memory properly, and it remains charged, and I tell you, it can remain charged for many, many years, it causes a huge disruption to the stress system, and it results in emotional dysregulation in many different ways. This might be important at this stage to capture the idea that when we're talking about dysregulation of emotions, most people think of hyper-aroused states, agitated, anxious, angry, fearful. But don't forget that emotions can be dysregulated in a hypo-aroused manner, shut down, cut off, numbed out, dissociated. So in fact, there is what is commonly referred to as the window of tolerance, within which we aim to stay so that we don't get too over-aroused or shut down. And there's reasons why we might become over-aroused, and there's reasons why we might shut down. And I'm going to hopefully at least give you some introduction to some of those ideas in this talk. So there are my disclosures briefly. And I have one more to add to that, actually. I am just about to start writing a book. My area of specialty is in adult ADHD. I am on the executive board of the main organization for adult ADHD in the UK, and I actually I'm the director of education for that organization, UCAN. But I have another hat as well, which is worth mentioning because I'm going to talk about it a little bit today. And that is that I am a co-director of a great organization called The Grove. And The Grove has done a number of things over many years, but it's a therapy practice for many years. But over the last 10, 12 years, we've really focused in on providing high quality education to mental health professionals. We run a number of courses, and you can go online and have a look at some of those courses. But the one I'm going to talk to you about today is a course that I dreamed up a few years ago and launched this year, and it's called Regulate. I'm going to come back to that in a moment. So my main area is adult ADHD, and I do a lot of thinking and talking and writing around adult ADHD. And the way it links in with this story is that in ADHD in adults, we know that we consider it as one of the core symptoms, emotional dysregulation. The symptoms of ADHD include inattention or distractibility, impulsivity, and hyperactivity or restlessness. But many people would say there's a fourth central core domain, and that is emotional dysregulation or mood instability. 95% of adults with ADHD have real difficulty regulating their emotions. And working with this patient group intensively over a number of years, I've realized quite how disruptive that can be to relationships, to communication, and many, many other levels. And so I've been working with the idea of regulating emotions because of through trauma-focused work, through my work as a liaison psychiatrist, and latterly in terms of my role as an ADHD specialist for adults as well. My journey into the hypermobility world has come over the last 10 years, when I started realizing that many of my patients with ADHD, my clients and patients with ADHD, were hypermobile. And I just couldn't understand the connection, and spent many hours over the last 10 years investigating that relationship. And it's not for today, but it's very important to understand this interface between connective tissue disorders. In fact, not just hypermobility, but the cluster of syndromes that come together with hypermobility, dysautonomia and mast cell activation issues, and autoimmunity and gastrointestinal dysfunction as this cluster. And each of them have the potential to cause neuropsychiatric symptoms, and we'll talk about that in a little bit more detail. But essentially, all of the range of mental health symptoms, including emotional dysregulation, are much more common in this patient group for a variety of fascinating reasons. So let's keep the focus on today. And I've introduced myself, but I'm going to tell you a little bit about our Regulate model, because it's really relevant and useful. It's a synthesis of everything that I've been putting together over the last couple of years whilst writing and building this course. And I think it captures the range of approaches, particularly that we can use to regulate emotions. I'm going to shine the focus on hypermobility syndromes, EDS and HSD, briefly, just to think about why there is probably a bigger problem with this in this particular group for good reason. I'm then going to get into the body of the talk and think about how our normal system's physiology is set up to regulate emotions, and how that physiology can get disrupted, looking at one particular system in the body in some detail, the autonomic nervous system, and in particular, the parasympathetic nervous system, of which the vagus nerve is critical and central. And we're going to really use the vagus nerve as a pathway, as an entry point into really effective emotion regulation approaches. And think about how we can manipulate the vagus nerve, activate the vagus nerve in different ways, and to bring calm to the system. Okay, so Regulate. So I decided this was an important course because regardless of whatever specialty you decide to train in as a psychotherapist, regardless of what strand of medicine that you practice or type of coaching that you do, we all experience clients or patients in our clinic rooms, in our consultation rooms, on Zoom, often becoming dysregulated by the nature of the work that we do. And I think having a system, a model, and a range of tools to be able to better manage emotions is a really, really important thing. So I've drawn together what I think are the best, the most evidence-based, the most effective tools and techniques to achieve that goal in this program. This on the right of your screen are some of the people who are on the faculty of teaching on the program. We've got some amazing people. The bottom on the left, Dr. Hugh Selsick is probably the leading sleep psychiatrist in the UK. Above him, Phil Mullen, so he's on his 14th book, and a real leader in the field of energy psychology, a psychologist, psychoanalyst, and psychotherapist, an amazing thinker, and he teaches a day on the course. And above her, Viola, who is one of the most influential microbiome analysts and experts in the country, and a couple of the other directors in the Grove who are fabulous educators and great psychotherapists. And then Cobus at the top, who's the president of the main adult ADHD organization. So we've brought together not only people who are expert in their fields, but people who are expert at communicating these important ideas. It's a diploma or a certificate level, and at the moment it's for professionals working in mental health or healthcare in general or professional development. But the idea is we're going to take this Regulate concept and provide a variety of different trainings and educational packages so Regulate for parents, Regulate for schools, Regulate for businesses, etc. So the idea is that we're introducing this toolkit approach and seeing emotional regulation as really important and spanning a number of different areas. And this is my attempt to capture some of those areas, because when you think of emotion regulation, I suppose everyone thinks of different things. I would immediately think of, okay, taking a few breaths. So the idea of using the breath, the body, of course, the breath to bring calm to the system. And there are a number of other approaches that utilize the body, not just the breath, but acupuncture points that can be tapped or touched or needled or massaged. There's movement and a variety of different approaches that involve movement. Touch is a hugely powerful form of emotional regulation, taking us right back to that critical period between caregiver, usually mother and infant, where touch and eye contact and skin contact was fundamentally important. Light is a very interesting area in terms of the circadian rhythm and how interlinked that is with our mental health, and getting light exposure and vitamin D levels, of course, linked in there. And then a whole load of new research that's emerging around the importance of heat and cold, deliberate heat and cold exposure. And some of the data is very exciting around mental health and stimulating higher levels of dopamine and noradrenaline and modifying the endorphin system in a really positive way. So the body and the sound as well. I just pulled up this singing bowl here just to give you the idea that these are not new ideas. People have been using sound and other forms of sensory stimulation for many years. And we move away from the body and we think about the mind. And the mind is obviously where cognition and a more cognitive approach to emotion regulation, how we see things, our mindset, and a whole host of other issues that are more cognitive in nature that can be modified and manipulated in order to bring more regulation to the system. A whole range of creative approaches, that are powerful at regulating emotions. And then if we shift the focus away from the body and the mind to around us, to the environment, and how we engage with the environment, we engage through our 8 senses. In fact, many people think of 5 senses, but there are 3 others, less known ones, and we'll talk about that in a moment. And how we can modify our environment to be calming to the system, changing stuff around us, making sure we're around green, open spaces, making sure that we're breathing fresh air, and thinking about how we order and organize our space. But also, we're able to modify what comes in through our senses and how you can play with that. And you can think about, what can I change in terms of what I hear or what I smell or what I see that's going to impact my ability to regulate emotions. You can't think about regulation, as I've hinted at already, without considering this concept of co-regulation, of regulating between you and another. And that other may well be an infant, but it could just as easily be a parent or a sibling or a friend or a colleague or a boss. And our ability to communicate in a regulated way without being hijacked by our stress systems, the importance of recognizing when a situation or conversation is challenging or going to be challenging, or when a conflict has started, and how to negotiate that effectively. This is also really, really important in terms of regulation. Lifestyle, if we don't have the basic housekeeping, as I describe it, our sleep, our nutrition, and our order of our life in terms of our timetabling and our routine, if we don't have this basic stuff in place, our time management, our task management, very quickly life can get on top of you. And it's so important that you get those foundational areas balanced and sorted if you're gonna really tackle this issue properly. I've given energy psychology its own bubble. This is a newer area of psychology and of understanding. It's too much detail to talk about in depth today, but it's a fascinating area, particularly when it comes to trauma and mental health. And the tapping technique, emotional freedom techniques, is one of a number of different approaches that at least purports to be working with our more subtle bioenergy systems, often using the acupuncture meridian-based system, in some cases using the energy hotspot, the chakra system, and identifying and clearing trauma and trapped emotions and blocked beliefs in quite novel and exciting ways. And it's really important to keep an open mind about this stuff, even if it looks slightly strange or different. And there are increasingly a whole range of devices and resources and aids that can help with emotion regulation. I showed you one just before. This is another one, a massage stick. This is a great device here, which I would strongly recommend. It's called a Sensate, and it uses vibration and sound waves really to I think stimulate the vagus nerve and do the thing that we're going to be talking about a bit more today. There's another one here, which is a device that you clip onto your ears with these little clips, and it uses a very low current of electricity. It doesn't hurt or anything, but it has quite a powerful regulating anti-anxiety effect. So there's a whole host of other stuff, but there's just a few examples of how there are external devices and that we can be using to help regulate. So looking at EDS or HSD, the hypermobility spectrum group, why is emotional regulation an issue. And by the way, you might find I'm switching between emotion regulation or dysregulation and emotional dysregulation. The two terms are used interchangeably, and I haven't quite worked out which one I prefer. But anyway, in this particular patient group, this is a bit of a problem. In fact, there are high rates of mental disorder across the board. And there's, again, separate discussion to think about those relationships and why. I think my 2 bullet points at the bottom there, I think, give you big clues as to what I think are some of the connections, physiologically at least, that for various reasons, dysautonomia is much higher. This is the disorder of the autonomic nervous system, which we're going to look at in a moment. There's more issues with dysautonomia, and there's more issues with neuroinflammation, so brain inflammation, primarily as a result of mast cell activation disorder or syndrome. It is worth looking into this area if you haven't already. And I have some talks on the internet that you can look at if you need to. Managing ADHD Part 1. I talk about these relationships in a bit more detail. But simply having a long-term chronic illness, an illness that is not really understood properly in our current healthcare system, a system that means well, but sometimes does a disservice, particularly to this patient group, because of a lack of understanding, really, of systemic presentations of illness. We have become a little bit too subspecialized, in my opinion. Everyone has become a real expert in their area of the body. But the idea of having a much more systemic take and thinking about the body as a whole and how all the different bits interconnect and interact is important when you're thinking about syndromes that affect multiple systems of the body. And all too often people are told that they are somatizers, or they're making it up, or it's all in the head. And it's very much in the body, and it's very real. And I think the frustration and the angst that gets generated when you're sensed that you're not believed, or that people don't have an answer, or that they don't even have a frame really for understanding your difficulties, and that you might know much more about it than some of the doctors that you're meeting, can be frustrating at the least, but it can be devastating, actually, to be misunderstood and not believed. And the pain that this group experiences is really important, because pain does cause mental distress, and it takes energy, and it's arduous over a long period of time. One of the things that I've seen in this group, this big super syndrome, as I like to see it, is that a sense of people's system being on a low level, high alert the whole time, in defense mode, ready to react. And there's good reason for that. When your connective tissue is dysfunctional in some way, it results in proprioceptive difficulties. So the sensory system that tells you, the part of the sensory system that tells you where your body position is in space, where your arms or legs are, that allows smooth, coordinated movement. That proprioceptive input is reduced in hypermobility. And when your feedback coming in is reduced or impacted, then it leaves you feeling ungrounded, uncontained, unsafe, and almost holding your body together and staying in protection mode. So there's good reason why emotional dysregulation is present in this group, but it's certainly not limited to this group. So let's try and understand a little bit about the physiology of emotional dysregulation. And I'm going to take you through, it might seem like a complicated slide, but it's not really. And I'm going to just explain this in a slightly simplified way, because it's everything you learn in medicine is simplified, and then you realize it's far more complex and multiple layers beneath one's more superficial understanding of things. And so I think this is my understanding, that when we experience something outside, external, actually, and internal as well, but let's just keep it simple, something external in terms of some input, some stressor from the outside, it's picked up by our senses, the 5 usual senses plus the interoception, which is the awareness of your internal body state, the proprioception, which you've talked about, and then the vestibular sense, which is much more about balance and movement. So that information comes in through the senses and it works its way up towards the brain. And all of those disparate bits of sensory information are integrated in an area of the brain called the thalamus. And if the data coming in suggests that there's a threat, the smoke alarm of the brain, the amygdala, which if you look at that skull that's turning around, you can see 2 almond-shaped red areas as 2 amygdala, and they are like the smoke alarm of the brain. They fire off, and that sets in motion a cascade of events. Importantly, the hippocampus, another area of the brain that's very important in memory and other things, actually. But the hippocampus will provide contextual information and allow us to see whether, add more data in to see whether it truly is a threat or not. So if you're sitting in the cinema and you see a train coming towards you, then if you didn't have a contextual input saying, actually, no, it's a cinema screen and we're not going to get hit by the train, then you might start running out of the cinema when the train comes towards you. But because your hippocampus is providing that contextual information, it doesn't fire in the same way. So once the amygdala is fired, there's a pathway to the hypothalamus, and then 2 systems kick into action. One system, the autonomic nervous system, is a rapid response system, and the HPA axis or system is the hypothalamic pituitary adrenal axis, is a slower system, very important, but a slower response system, the output of which is cortisol. And we're going to have a quick look at both of those systems in just a bit more detail. So this immediate response, the autonomic nervous system, the output of that, there's a lot that happens, but the output of that, one of the outputs of it is that adrenaline, the stress hormone adrenaline, is released by the adrenal glands. And you can see on the little image at the bottom of the screen that you have 2 adrenal glands, and they sit on top of each of your kidneys, left and right kidney. And the adrenal gland has 2 parts to it, the cortex and the medulla, and they each release different hormones. And the 2 biggies are adrenaline and cortisol. So the immediate releases of adrenaline via the autonomic nervous system, and this kicks into action our cardiovascular system and our breath rate. It frees up energy in the form of glucose and oxygen by pulling more oxygen in, by releasing more oxygen where it needs to be, glucose where it needs to be, to give the system energy to react to that threat. Remember, you're going to need to, if something's happening, you're going to need to do something to protect yourself, to save yourself. The other system, the HPA axis, is also activated. The hypothalamus communicates with the pituitary, communicates with the adrenal gland, and ultimately the adrenal gland releases cortisol, another stress hormone that keeps the brain on high alert. By the way, the hypothalamus and the pituitary are both in the brain. their glands, and the adrenal gland, as we said, is in above the kidneys in the trunk region, and they're connected through the bloodstream and other mechanisms. Okay, so the autonomic nervous system, which is one of these two systems, this is the fast response system, is made up of two opposing systems or forces. Everything in the body, everything works as a balance or homeostatic balance between two opposing forces. There's feedback loops, and there's this balance that's struck. It's very beautiful to see it, and the system needs to adapt to whatever the current situation is. So if you're dealing with a crisis, then it needs to go into crisis mode. If you're not dealing with a crisis, then it can pull back and go into rest and regeneration and repair mode, because you're not actively having to use the system in a defense way. And the sympathetic nervous system, which many of you will understand as the fight or flight system, or even just simply as the stress response, uses the hormones adrenaline and noradrenaline, these stress hormones, whereas its opposing system, the parasympathetic nervous system, uses the neurotransmitter acetylcholine, and it's the parasympathetic system that's is like the relaxation response, the calming, anti-arousal response. It counters that sympathetic drive, and some people refer to it as the rest and digest system, because it's when you are not in that threat state that you can go about the process of digesting food in a calm and relaxed way, and use energy for that rather than running away. So we've seen that this autonomic nervous system is really complicated. It's got various different aspects. And why is it called the autonomic nervous system? Well, autonomic, a bit like automatic, tells us that it is managing those automatic functions of the body. We don't really think about releasing bile or the peristaltic movement of our gut, or how much insulin is released by our pancreas. We don't think about it consciously. It just happens automatically, and it's managed by the autonomic nervous system. So it's regulating these key bodily functions and switching them on and turning them off. And two of those bodily functions, so we talked a bit about the gut here just now, but it's also the heart and the lungs that are innervated by the autonomic nervous system. So this fine control of blood pressure and cardiac output allows blood to get redirected to where it needs to be. And so you can see how this system that's running the body in the background also doubles as a stress system, because all of that needs to calm down and shut down when we need to react quickly. So people see stress as a bad thing, but it's not a bad thing. It's a normal thing. In fact, we need stress to improve our performance in many ways. We all had the experience of feeling quite stressed, and up to a point, it being activating and helpful. But there is a point at which things decompensate and the stress becomes problematic and performance goes down, and the impact on the body of a short-term raise in blood pressure, release of stress hormones, turns into a longer, more chronic picture, which over time can do damage to the body. So stress is okay, acute stress is okay, even repeated acute stress is okay. What we're trying to avoid is a chronic stress state, or stress that's so overwhelming and so dysregulating that it really knocks us over. And last point on this slide is that it doesn't actually need to be a real threat. It just needs to be a perceived threat. So perception and beliefs infused together with reality when it comes to stress and the stress systems of the body. So we've talked about the amygdala brain smoke alarm, really central point for really deciding whether we're going to go into that stress response state. And when we do, assuming that we're going we're reacting to a real threat. The adrenaline release causes a variety of things to happen. Muscles will tense. The pupils will dilate to allow more light in to see the world and what's going on around us more clearly. Perception of pain is blunted. The heart rate, the breathing rate goes up. And again, all this energy. And then the functions like digestion, which are less important, are put on hold. Whereas if we look at the parasympathetic bit, it's actually made up of two sets of nerve fibers. One set is a handful of nerves that are called cranial nerves, but the real big one in there is the vagus nerve, which is cranial nerve 10. In fact, there's two vagal nerves, one on each side. There are a few nerve fibers that come out right at the bottom. You can see that the lower part of the spinal cord, which innervate the distal bowel and the bladder. But the vast majority of the parasympathetic system is the vagus nerve. So really, when we think parasympathetic, we think vagus nerve. And by the way, this balance between sympathetic and parasympathetic is really the functioning of the autonomic nervous system is captured by the measurement of heart rate variability. So when you test your heart rate variability, you're essentially saying, how well is my autonomic nervous system working? And if you have high heart rate variability, like a good thing, then you can also think of it as having boosted parasympathetic drive or increased vagal tone. These are the words that we use to capture this idea. So let's look at the vagus nerve. You can see on the left side of your screen, all these areas in yellow. That is the vagus nerve making its way. It seems like it's making its way down, doesn't it, from the brainstem through the various organs we mentioned before. But it's not just down. In fact, the majority of the fibers of the vagus nerve are actually taking information from the periphery, from the organs, from the outside, and delivering that information back to the brain. So that's called afferents. So 80% of the vagus fibers are actually the periphery back to the brain. It's the input that's coming back and saying, all is good here or not. 20% of the fibers are having an effect on the end organ, releasing a bit more bile, contracting some muscles, closing off this, opening this. So those are more motor branches, or efferents, as they're called. The vagus nerve, or the vagus nerves, do come off the brainstem and come down, but they actually send a shoot off to the face and the head. We'll look at that in just a moment. But it's not shown on this diagram. So the vagus is the longest nerve in the body. It's sometimes known as the wandering nerve because it literally goes and covers so much of the important functions of the body. And you can see when it reaches an organ, it sends like a net out of nerve plexus that sort of wrap around the organ and capture this very sensitive data. And so the vagus is the parasympathetic is responsible for this shutdown response. And you can see the image of the cat and the mouse. I think on the previous diagram here, we could see the two sympathetic responses are to fight or to flee, fight or flight, so fleeing and running. So if you can run, obviously that's a preference to get away. If you can't run, you're going to fight your way out of a situation. But what if you can't run and you can't fight? So in the case of this little mouse here, imagine that mouse is in the corner and it's not going to win against that cat. So what will it do? Well, what our systems have developed, this freeze response. It's like playing dead. So the mouse can play dead, and the cat either will lose interest or will think that it's ill in some way, and therefore might walk away and not attack the mouse. And the chances of that mouse surviving are obviously greater by shutting down and playing dead. And in many ways, the hibernation responses are very much linked to this system. We talked about how this branch that comes up, and it's a really important part of the system, because if you look at the places that it innervates, you can see it goes to the throat area, so where the voice is generated, the voice apparatus. It goes, the auricular branch goes to the ears and actually supplies the sensory supply of many areas around the ear. It also goes to the meninges, the layers around the brain, and to some of the muscles around the eye. And altogether, this is referred to as the social engagement system when you are thinking about polyvagal theory, which I will mention in just a moment, very briefly. But this social engagement system, this is a more evolutionary advanced part of the parasympathetic nervous system, of the vagal nerve supply, because what it recognizes is that if you can not need to fight or fly or run away or play dead, but actually you can, through sophisticated interaction and communication, the tone of your voice, the smile of your eyes, a very acute sensitivity to the other person's voice and reciprocal interaction, you can talk down a situation and not allow it to escalate. So social engagement is a way of averting stress to the system. And the vagus nerve, this is, I think it's Beijing Airport in China. This is my representation of the vagus nerve. You have the sort of the central hub, which is the brain, and then you have a number of different runways going to flight paths to different countries or organs, and information flights coming back the other way. And the understanding that this whole system has to work together, because if one part of it messes up, the whole system becomes dysregulated. And so if you've got a problem with flights coming in from one hub, it's going to affect all of the other parts of the system. And so this is quite relevant and appropriate for thinking about the vagus nerve. And we could spend hours talking about polyvagal theory. This is Stephen Porges' work. A model to understand these various aspects of this part of the this part of threat system, and in particular, this evolutionary stepping up, going from the earliest response evolutionarily, which was the freeze response, this parasympathetic or dorsal vagal. And then the next step up is the fight or flight sympathetic response. And then more recently, the evolutionary layer of the social engagement system. And that's the ventral vagal, the front vagal, as it were, accessing the face of the front. The system is probably a little bit more complicated, and this is probably more a sort of simplified model, but it makes good sense. And you can see that all the different themes that are associated with each of those responses. And obviously, we want to stay in the green zone, don't we, with joy and groundedness and connectedness and mindfulness. So not allowing ourselves to activate those responses as easily, at least. So there's various different ways that we can stimulate the vagus nerve or activate the vagus nerve. There's even surgical procedures. In fact, much of these ideas and this is rooted in this surgical procedure to literally clip an electrode to I think the left vagus nerve, and by stimulating the vagus nerve, it can be effective at reducing seizures and improving depression and mood-related issues. But obviously, it's very invasive to do a surgical procedure, and it's expensive, and it's got risks associated with it. So there are various vagal nerve stimulating devices that are external, medical devices. And then more recently, a number of other devices. I've shown you two of them here, two of them. This one does talk about the vagus nerve, and this one, alpha stim, is being looked at the moment. And I'm involved in some of that investigation to think about whether it's exerting its action through vagal nerve stimulation. But in addition to devices that you either put in or on or near your body, there are lots of different things we can do that have been shown to boost vagal tone. And how do we know that these things boost vagal tone? Because for a long time now, we've been measuring heart rate variability, this very sensitive measure. I'd argue probably the only sophisticated measure of mental health, but of the autonomic nervous system, that captures a snapshot of where things are. So I'm going to just introduce you to 4 different approaches to stimulating the vagus nerve. And without doubt, the biggest, most important one to grab your attention is the breath, because the breath is designed, it's integrally woven into the autonomic nervous system's function. And simply by slow, deep diaphragmatic breathing at a particular rate, and it's called the resonant frequency. How many breaths per minute for this individual is required in order to shift their heart rate variability from what we term as a chaotic pattern with low variability into a coherent pattern with wide variability. It appears that there is a specific resonant frequency for everyone. It's normally around 6 breaths per minute. So that's 10 seconds for both the inhalation and the exhalation. So each breath in and out is lasting 10 seconds, leading to 6 breaths over a minute. And give and take 1 or 2 breaths, that is what most people's resonant frequency is. So simply slowing your breath down and doing deep abdominal breathing, which means not just chest breathing, but allowing your diaphragm to push right down. You can see in the image, the diaphragm pushes down as the lungs expand, and push down the diaphragm, the abdomen comes out, and stimulating certain receptors in the lower part of the lung and really boosting vagal tone. And it's also been shown that mouth breathing is not that good for you in terms of the autonomic nervous system. So nose breathing, nasal breathing is shown to increase the vagal tone. So you can actually get tape. It has to be the right tape, because I'm not sure sellotape would do it, but tape over the mouth at night, and it results, as you might expect, in you breathing through your nose, boosting your vagal tone. And there are many approaches that use the breath, the slow breath, such as yoga and meditation, which can really effectively train the breath and spend more time in this resonant frequency. We talked about the vagus nerve sending this route up, this auricular branch to the ear, the region around the ear. And you can see those areas which are shaded on the left around the ear, the different parts of the ear that the skin of the ear is innervated. And that's including parts of the canal, the ear canal leading to the tympanic membrane. Again, it's got vagal nerve stimulation. And simply by massaging gently the ear and stimulating these points, you can have a really powerful and calming effect, really tangible. You can feel it. And interestingly, the lighter you touch when you do these exercises, the more potent the effect. So just to give you an example of one exercise that might involve the ear. So if I put my finger inside my ear canal, and then I put my thumb behind my ear, it's called the mastoid process, and I sort of pinch those 2 areas together gently, and then I reduce the pressure by 80% from what I just did. So literally just touch those areas. If you're sensitive, then you'll feel some activity in the gastrointestinal tract. You've noticed you might salivate a little bit. notice that you will feel a bit calmer. But not everyone is sensitive enough to pick that up straight away. And it just takes tuning into your body and the sensations of touching very gently these important areas. Interestingly, again, the vagus nerves supply laryngeal and pharyngeal branches, the branches that go to the throat. They're involved in speech and singing, because when you vibrate that part of the system, it stimulates the nerves in that region. And we know that stimulating with sound can be a boost to the vagus nerve. And isn't it interesting? The sounds that generate that vagal nerve stimulation seem to be sounds that include that and ooh. So these vibrating sounds in the back of the throat, it's the origins of the Om. It's a combination of those three letters, and actually links with the word Amen of prayer. So it's not new stuff. We're just, I suppose, working backwards and reverse engineering and understanding some of these practices. And just to finish off, I mean, it's not a great thing to discuss at length, but when you suppress that urge to open your bowels, when you hold on for longer, ideally with that, not in a panic state, but in a calm state, you're literally training the vagus nerve. So staying calm while resisting the urge. Some people take this a step further and use coffee enemas, but it's not necessary. You can train it in that way. And there's loads of other approaches to stimulate the vagus nerve. One that's got a lot of attention recently is cold water exposure, so ice baths or plunge pools or even just a very cold shower. The benefits that you get are very much linked to the parasympathetic nervous system. So just a few things to think about and play around with there. But I think the central message is that there are many different ways to regulate your emotions, ways of manipulating the body, the breath, points on the body, inputs to the body through the senses, modify the environment to change the way that you think about something, to change your mindset or your cognition, to use creative approaches, to use devices and aids, to think about regulation in relation to the other in terms of the way that you communicate and that you manage conflict, and managing the really important basic housekeeping foundations of sleep, diet or nutrition, and creating a stable, ordered life as far as possible. So hopefully that gives you a little bit of insight into the way our amazing bodies are set up to protect us, but that in certain situations and in certain groups, that system is not working optimally. When your autonomic nervous system is not working properly, it's referred to as dysautonomia. And that when people have dysautonomia, not only does it mess with the way that our organs function, our heart, our lungs, our guts, but it also leaves us in a perpetual low-level threat state, hypervigilant state. So we have to become good at being able to regulate our emotions better, because when we have a toolkit, you're less likely to get dysregulated, because your system, your unconscious mind knows that actually there's no point in getting too stressed out because you can calm it down. So it just doesn't get as stressed out. You sort of adjust to it. So really an area that's worth a lot of investigation. And if you're interested in taking this further and learning with us, and you're a professional working in the field, then please do come to the growpractice.com website and have a look at some the Regulate course, but some of the other great courses that we offer. Anyway, it's been a pleasure talking to you today, and I hope that you find a few nuggets in there that are helpful for your life moving forward. Thank you very much.